Let's get started. Are you guys ready to go rock and roll? Dr. Alberto, to share your screen.
Yes. So, first of all, I want to thank the whole team for this invitation. It's been an interesting challenge, intellectually challenge for me to get into this topic because it's a hot topic. And as a hot topic, it's not only about science, but it's also about social media, about marketing, about people, about clients, about patients, about companies, such as the work that Karla is doing. So that's why when I got invited, I wanted to go in depth about NAD plus. I call it NAD plus. Sorry, it's my deformation of the language, but it's NAD plus peptides, and why it works in skin aging and clinical applications. So we're going to try to understand the reason behind that, the science behind, and we're going to go very in depth. And I would really appreciate that if Karla, Barry, or Jenny, if in between some question, very hot topic question pop up, let's ask to me immediately, because it will be very interesting that we have this conversation. So very briefly about me. First, I'm a bachelor in biology. Then I got my PhD in medical science. I was living in New York, part in Chile. Then I moved to Japan. I started doing research in dermatology, and then I got my medical degree in Europe. Then I studied aesthetic medicines, and then my love for aesthetics moved forward to the classic dermatology. And nowadays I do aesthetics. I work in the industry. I am a medical advisor from several companies, and I'm KOL for different companies as well. And I travel around the world, not only teaching, but also learning by myself, like these trends and how these products are emerging everywhere. So first of all, I want to start telling you that aging process is crazy complex. It's not only about one molecule. It's not only about one little metabolic pathway. So when we jump in the field of anti-aging medicine, we have to understand that it's very complex, but also it's very dynamic. I was in one of my trips, and I was giving a training in Sweden, and one of the doctors, a plastic surgeon, an older doctor, he said to me, "You know what, Alberto, every day we're getting rotten and rotten." So we are getting older and older. And as we're getting older and older, it's not about stopping the aging process. It's about guiding the aging process to a healthy, but also to a graceful aging process. So we have what we call the chronoaging, what we can see here on the right. That means that as we get older, different metabolic pathways get affected, and we're going to talk about, especially about mitochondrial dysfunction. But also we have about the photoaging. The photoaging is everything related to the damage that the UV light, UVA, and UVB makes to the skin. Also, we have understood about something called the exposomes, everything that outside us, everything extrinsic that accelerate the aging process. Smoking habits, air pollution, chemicals, air conditioning, nutrition, lack of sleep, and stress. Those are the 7 most important exposomes. All these combined are going to produce DNA damage, telomere shortening, protostatic dysfunction, mitochondrial dysfunction, and together they're going to create the senescence. And the senescence is not the death of the cells, it's about the cells getting light and slow, and they regenerate less. And in the skin, we have what is called the skin atrophy or the dermatoporosis. That means that the skin cells act less. So we can have patients in the late ages, 70, 80 years old, with amazing skin that they have took care very well, that they are not exposed to UV light, that they take care very well of about their environmental factors. And we have patients very young that they have early signs of aging process. And I always show this, and I show it more than I should, but this is from System Biology of Human Aging from 2019. It shows everything that happens in the aging process. So it's so many aspects that we have to take in consideration. And that's why there is not this miraculously product. There is this not miracle product or miracle treatment. That's why in aesthetic medicine, we do 100 things at the same time. And that's why we are investigating, we are doing research in new ways to improve the aging process. We have understood that the skin age in 3 main pillars: the visible aspect, the topographical aspect, and the mechanical aspect. The visible is everything that we observe: the redness, the dullness, shallowness, radiance, shines, and even pigmentation. The mechanical is about the firmness, the elasticity, pliability, And the topographically, it's an interconnection that is related mostly to wrinkles and also to the texture. When we understand these three main pillars, we're able to select treatments, and also we're able to select different approaches for the anti-aging or for the regenerative approach. Also, we have understood that the aging process happens in two main layers. In the superficial layer, what we talk about the keratinocytes, macrophages, what we know about the nodal cells, melanocytes, everything that is visual, that as we get older gets thinner. That's why we call it the atrophy of the epidermis. And at the same time, in the deeper layer below the basal membrane, we have the dermis and we have the reduction of the collagen production. This is very important when I give the lectures to in the medical aesthetic field, because we have different approaches. When we treat, for example, with a polylactic acid or with a biostimulator, we go deeper layer to produce collagen, but in the surface, we need to attack it in a different way. And that's something we're going to talk more in detail today, because the approach of NAD+ and the approach of peptides, it's an approach that we talk about the surface of the skin. We're talking more in the surface of the skin, and that is going to give that effect in the visual aspect. As we get older, we get more tired, and that is called mitochondrial dysfunction of the mitochondrial theory of aging. And it's not only a theory, it's already well established. Our mitochondria are organelles that are part of the cells, all of our cells, that they are in charge of producing ATP. It is the energy of our cells. As we get older, our mitochondria get dysfunctional. They start getting smaller. Their structure change. I have published papers about it regarding the effect of mitochondrial dysfunction is tied to diabetes, in metabolic syndrome. That happens as we get older. And as we get older, we produce less energy, and the lack of energy increase the oxidative stress, more cellular damage, more accumulation of oxidative stress, and that is going to produce less activity of the cells. That's why we, in the area of aesthetic medicine and aesthetic dermatology, have worked in the field of restoring energy. We're talking about energy because traditionally, we talk about collagen production. And I always tell my colleagues and my friends everywhere in the world, don't get obsessed with collagen. It's not all about collagen, because I see everywhere in the world, everyone wants to get Sculptra, everybody wants to get collagen in their skin. There are products based in collagen, and it's not only about the fibrosis of collagen. It's about the aging of the skin that is associated with mitochondrial dysfunction, oxidative stress, reduction of peptides, and that it's going to restore the metabolic activities from inside out. It's not only about producing collagen. What is the concept of NAD+ and peptides? NAD+, as we get older, and we're going to understand what it is, these molecule levels also get lower. We're going to understand how it works. As the NAD+ levels get lower, we have less ATP, and we have reduced cellular response, and that means that our skin and our body gets tired and it gets slower in metabolize. This is something we understand very clearly in our life. When we are in our 20s and we gain weight, we can lose weight super fast. In our 30s, it's harder. In our 40s, it's getting even more harder. But if we get in the 50s and 60s, it's almost impossible. That's because our metabolic processes are reduced, are abrogated. Our metabolic processes are slower. And that's the same thing that happens with peptides. And we're going to talk about which peptides. Don't worry, we're going to talk about that in detail. So the approach of this concept of regenerative dermatology or regenerative cosmetics, it's about restoring those metabolic processes through the NAD+ or through the peptides to create a metabolic impact in the cells, and then the cells regenerate. It's not only about collagen production or giving hyaluronic acid or giving paralyzing muscles. It's about going through the key component of the aging process. The concept of NAD+ is associated directly with mitochondria. We're going to talk about the sirtuins, about the DNA repairment, and the peptides about working in certain receptors, creating this microenvironment for the cells and then enhance the cellular response. Let's talk in detail about NAD+. NAD+ stands for nicotinamide adenine dinucleotide. It's a small nucleotide that works and is part of the cycle. It's a very important part of the bioenergetic process of the mitochondrial. It's also a signal process that it's going to, through the metabolism of electron transporter from NAD+ to NADH, it's going to push for the redox balance. It's going to create the balance for ATP production. And that indirectly is going to restore the nucleic acid. It's going to reduce inflammation. And through the pathway of the sirtuins, we're going to have a traditional and a natural anti-inflammatory. The concept is very strong. It's very hard to understand, but here we're going to go in detail in very specific ways. Something very interesting, that one of the main components that reduce the NAD+ is the inflammation associated with high-fat diet. NAD+ originally was studied in the hypercholesterolemia, hypertriglyceridemia. It was studied in metabolic syndrome. And NAD+, I remember papers of the 90s when I was in the PhD or the undergraduate studies, and we used to study the old papers of NAD+ of the 80s and 90s. There was a study for a treatment for overweight patients. It was like the Ozempic of the 90s, the NAD+. The concept of the NAD+ was to give something to accelerate the metabolism, and through the metabolism, we activate a pathway called the PRP that accelerate the energy and that burns fat. The whole concept of NAD+, and I still remember some injectables of NAD+ for fat burning. But it was understood that NAD+ was not only about fat. Then it was a study that NAD+ activates certain pathway called the sirtuin-1 and sirtuin-3, that in pancreas, it's going to accelerate insulin secretion. In the brain, it's going to the cognitive function. In the skeletal muscle, it's going to activate the muscle volume formation. And in liver, it's going to increase the insulin sensitization. And it's very interesting because all these has been related to pathologies. NAD+ was first studied as a molecule that was affected during the metabolic dysfunction. So it was related to type 2 diabetes, as you can see that NAD+ reduction in insulin secretion, NAD+ in Alzheimer's, NAD+ in Duchenne. Duchenne is a muscle dystrophia, and also in the inflammatory of the liver. So it's very interesting that the first approach of NAD+ was related to pathology. And then we understood that NAD+, when is in the lower levels, when there is a depletion of NAD+, there is an accumulation of oxidative stress, there is an accumulation of DNA damage. But then when we supplement it, meaning that when we push the NAD+ to the higher levels, we have a restoration of the endothelial cells, we have a restoration of immune cells, in the keratinocyte, in the fibroblast, through the interconversion of a senescent cell, meaning that the cell is sleeping, to a cell that is awake. So the technology of NAD+ then moved forward to the regenerative biology of activating cells, and actually those early studies of NAD+ for the use of cells. So with NAD+, you were able to activate those stem cells and make them active. This is something that asked me, and it was fantastic. We were talking about it, about the evidence of the use of NAD+ in oral and IV therapy. And here, please, I don't want to offend anyone. I work in a clinic where the owner, she dedicates to medicine. She works in this field a lot. And I just want to tell you that this is only medical evidence that has been accumulated during the time. So first of all, I tried to collect all the data regarding NAD+ oral therapy. And NAD+ oral therapy has shown that from 2017 to the date, all the big clinical studies using 200 to 500 milligrams, even 2,000 milligrams daily, have shown that it's safe, but there is no real outcome. And what I mean about outcome, no changes in blood pressure, no changes in inflammation, no changes in people are not losing weight, no changes in the triglycerides or cholesterol, no changes in any metabolic. So nowadays, that's why the early stages studies of NAD plus orally failed. And that's why we don't have it like a medicine every day. It's because the clinical studies have not shown much. They have studied in obese patients, in hypertense patients, in patients with hypertension, with also patients with dysfunction, and nothing. What about the use of NAD plus IV therapy? It has shown mild effect in the improvement of cholesterol, also in reduction of hemoglobin, so meaning some markers of diabetes, and also some markers of liver and inflammation, the LAP. LAP is an enzyme, phosphatidase kinase enzyme from the liver. So it has shown certain effects as anti-inflammatory. However, clinical studies by the date hasn't shown anything beside inflammation, and the studies are very small, even when they're in a real world setting, meaning that they're normal people, not pathological people, not people with any pathologies. They have shown small results, and there's still a lot of work to be done. What about clinical studies of NAD plus in dermatology? It's very interesting because this is extracted from the course of the trial.gov, meaning that the NHS course clinical trials from the United States. There are multiple studies of the use of NAD plus in lupus, psoriasis, dermatitis, acne, damage after transplant, meaning a skin flap. So there are clinical studies in phase 1 and in phase 2. They're working. Do we have now results to show that it's working, to tell you, yes, it works? By the far, no. And that's why we don't have clinical for like use of NAD plus in dermatology. But we have is the experience. And that's what Karla is going to tell you. Because in the area of aesthetics, we are a little bit forward, we are pushing forward for understanding the NAD plus. So now let's move about what are peptides about. Peptides are a small group of amino acids, meaning that small pieces of proteins that they're going to prevent the aging process, or they're going to have any response on the cells. These amino acids can be combined with other things. We can combine it with different ingredients such as hyaluronic acid. We can combine it with different type of vehicles, with moisturizer and so on. And they're going to have mostly 4 effects. And that's why we talk about the 4 types of peptides. First, the signal peptides. And what are the signal peptides? Are these small pieces of the protein that they're going to activate a receptor, and in the receptor are going to produce collagen, or they're going to have any effect on the skin. Then we have the neurotransmitter inhibitor peptides, and this is the classic botulinum toxin, the Botox, meaning that it produces certain effect, and then it's going to paralyze the muscle. There was a lot of research in the field of arginine. Arginine was also quite popular in that time as this hexapeptide 6 and 8, 6/8, that was doing something similar to the botulinum toxin. Then we have the carrier peptides, meaning that they're pieces of peptides that they get attached to the extracellular matrix, and they're going to create support, and they're going to create hydration more than the effect of hyaluronic acid or the classic hydrators. And then we have the enzyme inhibitor peptides, that there are peptides that have certain effects, certain pathways. For example, the associated peptides to glutathione to reduce the effect of the melanin production. So let's summarize this, because it's very important that when we select products, we read about what are the peptides about. Signal peptides stimulate collagen, elastin, stimulate the keratinocyte and the epidermal cell proliferation, modulates melanogenesis. Carrier peptides deliver trace elements for wound healing to enzyme processes, stimulate also collagen, improve elasticity. Neurotransmitter, classic botulinum toxin that is going to paralyze. And then we have the peptides related to enzyme inhibitor peptides that are going to be moisturizer, but also are going to stop certain processes that they get hyperactivated during the aging process. For example, they associated to anti-pigmentation. several thousands of peptides have been in the market worldwide. Multiple peptides. And here we're going to go very briefly just because I want to focus in the ones of TalaDerm technology. But as signal peptides, the heptapeptide, tetrapeptide, the acetyl tetrapeptide 11, 9, or 1, so many names. And here are the commercial names that most of the time have been patented by laboratories, such as the Regine, the peptide EAL, the Corineal, the Matrixyl, and so on. Then we have the neurotransmitter peptide, the acetyl hexapeptide 3, that also is called the hexapeptide 6A, that is the adrenaline, this one that was similar to the botulinum toxin, the pentalopeptide, the axovol, the acetyl tetrapeptide, so many. Carrier peptide, the peptides that bring Cooper, and that is classically the tetrapeptide 1. And then the inhibitor, the rice peptide, the silk peptide, the soybean peptide, that they're also associated from the extraction of plants. So nowadays we have multiple. What is the problem with peptides? As they are little pieces of protein, if you just infuse them in any cream, you just put them in a cream, in any solution, and you put them in the skin, nothing's gonna penetrate because they are too big, or because the pH has to be neutral, or because they're not properly hydrated, and because the skin barrier is very selective. So nothing of these big peptides are going to penetrate. That's why the new technologies, and that's something that we're going to talk actively with Karla, it's about having molecular weight that they are proper for the skin, with proper encapsulation, that they are stable, but they're able to penetrate through nanospheres, that they're going to have enough surface for the contact from the penetration, and that it's going to make the bioactive ingredient to really penetrate in the skin. Traditionally, peptides, we do it through dermapen. So we just do dermapen, and then dermapen, it's going to penetrate. But we're talking about technologies in cosmetic fields. And in the cosmetic field, it's about trying to get this product inside without creating a lesion. And that's why Karla is going to tell you a lot about the formulations of TalaDerma, that they have this oily texture because they're going to be encapsulated in this nanoliposome. Let's talk now about the main peptides that we know that they work and with very strong scientific evidence. Let's talk first about the Cooper peptide, the DHK Cooper, the dimeric Cooper peptide that it's been studied. This is from a journal of the Nature Communication that is very prestigious, that have shown that this little peptide that has Cooper, when it's properly encapsulated and it's in this very organized capsule, as it's going to penetrate, it's going to reduce inflammation, it's going to activate proliferation and remodeling. That's why the use of Cooper peptide has been mostly linked, and this study is from 2025, very new, in diabetic wound healing, because we have this non-responsive inflammation that is creating this ulcer. So that's why this Cooper peptide has gained a lot of attention, and that's why it can be used also for anti-aging process. Now let's talk about the main peptides related to the structure. Palmitoyl tripeptide 1, tetrapeptide 7, hexapeptide 12, hexapeptide 37, tetrapeptide 3, and acetyl tetrapeptide 2. So what about these peptides? They are pieces of protein, non-animal derived, of course, that as they're going to penetrate the extracellular matrix, they're going to attach to all these fibers, and through the attachments of the fibers are going to stretch the structure. That is something that we call now the mechanotransduction. What it means that as we get older, one of the reasons why our skin is wrinkly is because we don't have enough structures that stretch. So that's why the kind of peptides reduce wrinkles. Now, let's talk very briefly about one important peptide related to signaling called the EGF-related peptide of the RH oligopeptide. EGF, TGF, and ARH are peptides related to growth factors, meaning that they're peptides that are going to activate the cell growth, they're going to activate the process of wound healing. And for that reason, this peptide is so important because it's going to activate proliferation, survival, angiogenesis, migration, and adhesion of the skin cells. So it's like we're giving a growth factor that we provide in the old school way through PRP, but now as a very purified that is not immunogenic, that you can apply just topically, and that is going to create regeneration. Glutathione, our big friend glutathione, and that's something we can talk. I have a whole lecture of a whole hour about glutathione. Glutathione is this small peptide that then it's going to be metabolized from the glutamine to glutamate to cysteine, this pathway of antioxidation. And one of the most important things is that glutathione has been shown to inhibit two pathways of the pheomelanin and eumelanin production, meaning it's a classic anti-pigmentation molecule. Glutathione, we use it as dermapen, we use it in chemical peelings. In some countries, it still is used as an IV therapy. However, in the use of glutathione topically has shown to have important impact in skin lightening and melasma treatment. So glutathione is one of our main peptides for the anti-aging treatment of pigmentation. And then we have something called the cap peptides. And this is another field that is wide to explain, but what it's about cap peptides are small pieces of proteins that they're going to reduce oxidation, inhibit cytokines, so meaning reduce inflammation and oxidative stress, that are going to restore the telomeres, so they're going to have an pro-regenerative effect, and they're going to restore collagen. So here we have Gabby having the first question. Does glutathione have the same lightening capability when injected? Well, so the clinical trials have shown that glutathione orally, meaning in pills, have less capacity than topically, because as glutathione is a strong antioxidant, has a lot of strong metabolism through the liver. So when you give glutathione orally, the first thing that it goes is through the muscles and to the liver. So the amount that goes to the skin is very little. So that's why glutathione, when it's topically treated, is a stronger effect than oral treatment. IV therapy, it's very controversial because it has shown this effect, a very strong but also very dramatic effect as an anti-pigmentation molecule. However, IV therapy has shown strong side effects and death of patients because the high levels of glutathione are associated in liver with liver dysfunction, with cirrhosis, and also with an augmentation of body temperature and heart rate. So if you give glutathione intravenously, you have higher risk of complications. So nowadays, for anti-pigmentation, shown that anti-pigmentation topically is the most acceptable. What happens in the process that we want to attack? In the epidermis, there is an epidermis, there is strong oxidative stress. This strong oxidative stress is going to lead to the activation of the MAP kinase, and then that is going to activate the inflammatory cytokines, TNF-alpha, interleukin-1 beta, interleukin-6, and that is going to create all the damage on the skin. We have elastase, collagenase, and hyaluronase that are going to break our extracellular matrix, and then we're going to have the skin flaccidity. That's why the concept of the peptides is to increase collagen production in a non-invasive way, improve the skin texture, be an anti-inflammation, improve hydration, and make the skin thicker and stronger. And this combined with NAD+, we have this strong combination of bioregenerative effect through energy, plus all the peptides that are going to reduce inflammation, are going to reduce oxidative stress, and are going to create this metabolic impact in the cells. This is something that I own to Barry. I offered to Barry to write an article about this, and I haven't even started. I'm very sorry, my deadline was today. It's about different approaches to infuse the peptides and to infuse the bioactive ingredients such as NAD+. One of the traditional ones is the iontophoresis. Then we have through ultrasound, through electroporation, through microneedling, and through thermal ablation. Those are the 5 most accepted approaches to infuse products. However, we have a technology that Karla is going to tell you more in detail, that it's about having these active ingredients without needing to use any for the penetration. And that's why the formulations that we're going to talk now in detail with Karla, Vitaferm, Lumivibe, and Cicaderm are the formulations related to the treatment of the skin through peptides and NAD+. And now I'm going to ask Karla to put her camera back because now we're going to talk because I want her experience. I just test the product. I had the chance to test the product, and I want to tell us a little bit how she integrates these products to the practice, Vitaferm, Lumivibe, and Cicaderm. Considering that Karla is a nurse, she does botulinum, she does injectables, she does all these kind of things, but she integrates these as non-invasive treatments.
Perfect. Thank you, Dr. Alberto. So Dr. Alberto just walked us through all that science, and this is how we bring it into practice, right? The line is structured with 3 core formulations. And then to your point, Dr. Alberto, even with injectables, this is a conversation I have all the time. Even with your injectables, we still need to take care of the skin on the surface, right? So for TalaDerma shines. So we have 3 core formulations. Keeping it really simple, the first one, the Vitaferm, is going to be the formula for firmness, collagen support, your aging skin. And then you guys can see there the peptides and the NAD+. NAD+ is on all 3 core formulations. And then we have the Lumi line. So Lumi being bright is easy to remember. So that one is going to be for your brightening, your pigmentation regulation. Works on multiple pigment pathways, right? A lot of times I find pigmentation products only address one, and usually it's tyrosinase. With this product, we are addressing multiple pathways in pigmentation. And then this Cicaderm line is probably the one that people are unsure of where it fits or what to do with this line. And the Cicaderm line is actually helps a lot with calming. Yes, it helps a lot with calming, with redness when you see pink in the skin, your rosacea clients, where this is great for post-acne scars, your stretch marks. So basically the way that I remember it is if you see it pink or redness in the skin, I'm most likely going to grab this formulation here.
So something that is interesting is that you can see here in the key ingredients, we have NAD+, but also, for example, in the Cicaderm, we have the Centella asiatica that has all these anti-inflammatory, but also this soothing effect. The glycosamine glycans that is also well known to be anti-pigmentation, all the peptides. And when we combine these treatments, we combine these active ingredients, we have this impactful effect on the skin. So that's why the concept is the post-treatment advantage that has this strong impact in the skin. I think there are some questions. No, not yet. So I'm going to ask now Karl about how this was born. Tell me your inspiration, why you wanted to have this innovation, how you reach, how in your mind the concept of using NAD+ in these products.
Yeah, really the concept of this came from what I was personally seeing in the treatment room and also what I kept on hearing from other professionals. I talked to professionals every day, mentored and in connection with hundreds of different providers. And I kept on hearing kind of the same conversation, the same story over and over again, regardless of what modality they were using, right? They're getting great results. So getting great results, but how do I make it better? Exactly. Or using this, it's great, but how do I make it better? At a certain point you're thinking about it, it's not really just about the modality or like that advanced treatments that we're doing in the room. It's about what happens afterwards, right? So really where this line was born is what happens after. How do we support the skin? How do we, right, push the boundaries to get better results with certain, we're seeing, right, pigmentation, all those things, like do we get better results there?
Karla, I love that because we first had a conversation about TalaDerma, and when we first started publishing content on it, conversation was very much around the fact that the aesthetics landscape is shifting toward more of a regenerative space. And so oftentimes, in order to get the skin to jumpstart the regenerative phase, there's some sort of trauma that we're inflicting on it. And more estheticians are bringing on so that they can have access to these trauma-based, energy-based treatments. And there's so many instances where we've seen that Patients are so focused on the treatment itself, and they think that getting the treatment is going to get them the result that they want, which, if you're looking at it on a spectrum from zero effectiveness to 100% effectiveness, the treatment's probably going to get you somewhere between 60 and 70%. And then when you go home and you start giving the body all of these peptides, the NAD plus and all the botanicals that you're putting in this impact the skin the way Dr. Alberto showed us, you see that increase go closer to the 100% because the body is jumping into regenerative mode and it's getting everything that it needs to heal. And as Dr. Alberto said, like, you look at signs of aging, there's no collagen or elastin. And that's what these are encouraging the body to produce. So I love that you brought this into the sort of space from these advanced clinical treatments. It's a testament to your medical background, to the history you have in working in the industry and being around treatments that bring trauma to the skin. So I just wanted to add that, my 2 cents in there.
Yeah. Thanks, Barry. Yeah, I'm something that another point, right? So with all different skincare professionals, your estheticians, your nurses, your doctors, I feel like in the last few years, there's been the pushing the boundaries, right? Doing maybe more treatments and all of that. And I think that that's all great, but also educating your client, right? If they're coming in for these amazing treatments, but they're not supporting that treatment, they're not going to get the most out of that investment. And also you increase the risk of actually things going worse or another scenario that is not helping the situation that you were originally trying to correct, right?
And to that point, Gabby asked, I thought, a very smart question. So thank you for chiming in, Gabby. Her question is, are these products capable of conditioning the skin for before any of these advanced treatments, or are they exclusively for post-treatment only?
No, and I think that was the one thing, right? There was so much emphasis on the post-treatment because I feel like that was the piece that a lot of professionals and also our customers or our patients were missing. They think they're going to just get this amazing treatment and what they do after doesn't matter really. I'm using something, right? It's going to be fine. For me, I love having the skin prepped before advanced treatment because they're going to get a better outcome and you're also going to reduce the risk of those unwanted side effects, so to say, I guess, can happen with these advanced treatments. So it can be used before, it can be used after, it can be used as part of your daily skincare routine.
Oh, I used the VitaFirm, like out of it, Karla, by the way. I ran out, like, saddest day was when I did the last pump in my hand. And I was like, no, it's gone. I'm obsessed with it. I've used that. I got that from you. I think you sent it to us midpoint last year when they were launched. And I used it every day until it was gone. Love that product.
Yeah.
So
Yeah.
very interesting that I want to just pinpoint is that when we do treatments, aesthetic medicine treatment, and educate our patients to have a proper skincare routine before the treatment, we can have better outcomes and even we can optimize our treatments to be less invasive. So the question was very good. And the concept that is that we can use these treatments and these options, these products before the treatment, but also we have a window in the healing process. And that is 24 to 72 hours. Sometimes we do a treatment, we do an aesthetic medicine treatment, such as the classic derma pen or a chemical peeling, and everything that we can infuse in that time is going to even give you a stronger results. So that's why the concept is that our skincare routine, our bioactive ingredients, our peptides, and our NAD+, it's before and after the treatment. And it's not only going to be about, as Karla said very well, improving the results, but also it's going to be about reducing the potential side effects. We know that, for example, one of the classic complications of derma pen when it's not properly done is post-inflammatory hyperpigmentation or a scar that is not properly resolved, and that is related to inflammation. So if we have these bioactive ingredients, we prevent that inflammation in a natural way. So that's why it's so important that we understand how to integrate this treatment. These treatments, we integrate them in our practice, we integrate the education. We have to understand that it's not only about hyaluronic acid and the classic ingredients. Now the technologies have moved forward to so many bioactive ingredients, and that's why we have this. And now I want to ask Karla a little bit about now in the practical way. So we have the booster for post-treatment recovery. the Lumi and also the whole line that comes in this Cicaderm and Vitader that comes in the syringes. So I want you to tell us a little bit how you practically use it. So for example, which treatment? So if you did a chemical peeling or you did a dermapen, how do you apply? How many minutes do you leave it there? How much do you use of the syringe? I want you to tell us a little bit more in detail about it.
Okay, so the boosters, this is your professional product. This is your in-treatment step, right? Really easy to integrate into almost any treatment you have. Basically, if you're doing dermapen, your microneedling, microchanneling, your laser, chemical peel, it doesn't really matter. You're going to do this after that protocol. So after you're done with that, you're going to apply these boosters. And the boosters are taking advantage of that healing window, right? I want to make a point really quick because this is a conversation I've had a few times and I had this very recently. The point of the boosters is to also help reduce inflammation. We're not stopping inflammation because I think there's a misconception that when you do these post-recovery products that you're stopping inflammation and they're not going to get results. We're not stopping inflammation. It's helping to control it, right? When you can have controlled inflammation, you're going to get a better outcome than that inflammation get out of control. So that's what we're doing. We're supporting the skin afterwards. Like I said, it just comes at the last, when you're done with whatever it is. You're done with your chemical peel, neutralizing everything else. You're going to put the boosters on before SPF, if you're going to be putting SPF or something like that. Laser, post needling, you're going to do this as that last step. It's super simple to integrate. You apply it, takes a couple minutes for it to absorb, and then you move on to, like I said, if you're going to do a moisturizer or maybe you're going to do SPF, then that will come after this. And again, you're going to pick the formula that fits the client that you're working on. So if it's someone that main concern is pigmentation, you're going to pull the Lumi formula that's going to be for pigmentation. If you're working on firming the skin, you're going to pull the VitaFirm. So it's really simplified that way. And then we're kind of head there, but there is a matching product for home care in, again, those same 3 formulations.
Karla, can I ask a question? Someone who's doing, like, let's say they're doing a CO2 or a halo, something like that. Those 2 modalities are focusing on both hyperpigmentation and laxity. Can you do layers? Can you do a layer of the Lumi V and then a layer of the VitaFirm?
You can, absolutely.
Okay. And then if someone's doing like mild chemical peel for someone who has rosacea, the Cicaderm is ideal for post on that, correct?
Yes. So
okay.
That would be perfect for that. If you're doing a microneedling on a scar, on scars or type of scar, that will also be the formula that you want to pull.
Okay, love. And then, of course, they can buy the retail to take home with them to use. And I layered both of those as well. So like my retail.
Yes. So you can layer them. You can absolutely layer them. I sometimes get lazy with my skincare routine. Sometimes I love a 50-step skincare routine. So we'll sometimes use one in the morning and one in the evening. It depends. So you can layer them or you can do them that way. Really quick, there's a question about the for the boosters. Do you use a whole syringe on each treatment? So I will say that they were intended to be single use. However, there is a lot of product on there. Or like you're just working on a face, it is a lot of product. So sure, again, depending on what your treatment you're doing, right? If you're doing a needling where there are pathogens and things like that, I recommend using a syringe. What is that called? So you can transfer yes, you can transfer the product into another syringe. So you're splitting it and you're not contaminating the rest of the product. But it is a lot of product in there. So sometimes for like face, I can get maybe 3 treatments out of 1 syringe. And then there's
Karla, I want to ask you a few questions about that professional line. First of all, that is to ensure that it's a product that is totally safe and sterile for use for after treatment that could be ablative. For example, a CO2 laser, you can apply it, but also that it has the about the pH. And that is something very important about how acid or how basic it is, because you have, for example, kojic acid and centella asiatica that tends to be. So how abrasive can it be for a patient with very sensitive skin?
So in formulating these products, the one main I had from my chemist was that it would be safe for open skin, right? So they are formulated. Yes, there's kojic acid in there. I always like to say more than just the ingredient, it's the formulation that makes a difference, right? It's the ingredients as a whole, and then also percentages of what we have in there. So yeah, so it is safe for that. I've used it. I use it with CO2. I've used it on myself. I've had CO2, and I've used it post CO2 as well.
And then, Karla, we've got more coming in the chat. They're using the chat for question and answers, making me crazy. So
Okay.
Nali asked, what would you suggest? Now, this is a multiple part question. What would you suggest for FITS 4 plus after microneedling? That's part one. Part two, she says, because FITS 4 plus is susceptible to hyperpigmentation. So that's the two-part question from Sonali.
Yes. So that's a really great question. Yes, our higher fits is 4, 5, 6. They are more prone or susceptible to inflammatory hyperpigmentation and things like that. So on the client in front of me, so if they don't have pigmentation, but they are more susceptible to that, I would probably use the Cicaderm, because that one has post-inflammatory hyperpigmentation, so what do I want to use? PIH ingredients in there. So I would use that in treatment room, and then at home, I would probably have my client using the Lumi for because it addresses more than one pigment pathway. So that's probably what I would do.
Perfect. And then we're getting more questions coming into the chat. If I could just ask you guys, if you put a question in the chat, please put it in the Q&A, because we are at 3 o'clock and they still have presentation to go through. So we're going to have to put the Q&A. We're going to have to respond to the Q&A after. So if you could put your question in the Q&A, we'll get to that after because I want to give them a chance to finish their slide deck, because we're at 3 o'clock now. So we just want to get into the final countdown here.
Yes, but just gonna make some little mention about the question of Sonali, and I totally agree with Karla. Just prepare the patient before and after with a product such as the Lumivibe. However, when you have higher Fitzpatrick's, you just reduce the intensity of the treatment. So meaning that if you're going to do normally 1 or 1.2 of depth of the microneedling, for a Fitzpatrick that is higher, go shorter at 0.5, 0.7. There is a question about if the syringe is injected. No, this is not an injectable. It's a post-treatment that it comes in the form of a syringe, because you can apply it easily and you just apply it there in the skin. Then about the questions about cost, that is something you need to talk with Karla, because I'm not familiar with the cost related. But just to finish, because we are running out of time, about the Lumivibe, this antioxidative and brightening, and the concept that is the NAD+, the biotin, the resveratrol, as all these components that are going to be anti-inflammatory. Plus, the daily use products that they are the ampules for the home use. And then we have the Cicaderm ampule for repair and calm. We have the Lumivibe that is used for the patients with pigmentation. And that is something you can, Karla mentioned, that you can just do your treatment, use the one for professional use, and then for the patient homes to use the one for daily use. And we have the Vitafirm ampules for the strength and collagen. This is for the skin tightening. And also it can be used for neck and décolleté to make skin thicker and stronger. So you have 3 formulations for 3 different indications that they are combinable and they are compatible with your treatments in the cabin, but also can be used with the professional ones. And then we have the Biomem Restore. This one I haven't treated yet. So the concept is that you integrate the TalaDerma into your treatments. And these are some before and afters that Karla was showing that are very, very beautiful, nice, about the improvement of wrinkles, redness, hyperpigmentation, improvement of the recovery process of a treatment. And that is the concept that you have your skincare routine in home, but also your professional treatments. Karla, tell us a little bit more about how they can find you, how they can reach you. Tell us a little bit more about it.
Perfect. So you can reach me via email or that phone number there. If you're interested in more about the products, pricing, all of that, the first step would be to create a professional account on our website. There's a QR code there. I was like, where? You can scan that QR code there. And then, like, I'm happy to have conversations with anyone else who has questions after this. I can walk you through it, how to use it, all of those things.
But you guys have to follow her on Instagram. Open your Instagrams right now. It's TalaDerma. Karla has an amazing Instagram with tons of examples of education. She has like time with you about what's happening with the brand. She shows you the brand in action. It's good. Karla, I'm going to address this to you. So we're going to give Karla all of the information for everyone who registered. So I'm certain that Karla's going to reach out with you with a little love note after this event. And we encourage you to get involved with TalaDerma, register for a pro account. These things are incredible. In-use product, for me, I used it. It was gone, like out, nothing. So absolutely love it. I think we've exhausted. Go ahead, Dr.
Yes.
Alberto.
Oh, yeah. I just wanted to say that also, if you have any questions, any sort of like, if you want to ask me something more particular, you can also find me in the social media. I put it there in the chat group. I provide trainings not only for medical purposes, but also for cosmetologists all around the world, where we learn different techniques and different approaches. I'm very sorry that we went very fast because it's a very big topic. Actually, I tried to make it as small as possible, but in the beginning I had like slides because it's a very fascinating topic, but it's a very hot topic that is growing and new science is coming. I'm very excited about the research that is coming from the clinical trials, what we're gonna see, if then in the future we're gonna have any clear NAD plus for pathologies. That is something that is coming, and for comprising everything in such short content, but in the future, for sure, we're going to be doing some updates and we're going to be harder in this field.
Well, that's fine because you're all going to get a link to the replay tomorrow. So they'll be able to rewatch it, take notes, stop it, digest the intense amount of information on slides. I was posting slides that you were on our Instagram story, and I was like, one of them is like, this is what we call advanced education.
Yeah.
Thank you for the in-depth education on the peptides. I know the community loves it, and we'll make this available on our website, lipglossandaftershave.com. You go to the education tab and then go down to webinars on demand. And in 1 month from today, it will be available for everyone to watch at any point in time. So there's going to be some great information out there for resources. Dr. Alberto, any final thoughts from you on today's event?
From my side, thank you so much. Thank you. It was very fun, and it was a big intellectual challenge for sure.
So excited. I'm so happy. I'm honored that we were able to give you that challenge, Dr. Alberto. We will do it anytime.
Absolutely.
Thank you so much, Dr. Alberto. Thanks, Barry, Jenny, and everyone that was here today.
Thank you.
Karla, thank you so much for being a part of this. We truly appreciate it. Any final thoughts from you, my love?
Thank you both for the in-depth education. And I know there are more articles on NAD and TalaDerma on our website. So if you guys just search TalaDerma, I'm sure they all populate underneath that, but take a peek and there's more to come.
Wonderful. Guys, I just want to say how grateful we are for everyone who is engaged in the chat and engaged in the Q&A. It makes the webinar so much more fun. You don't feel like you're just talking out into the ethos. You understand that there's an energy exchange happening, and it sort of like makes you more excited, and it makes the webinar, for me, it flew. I was like, I looked at my clock and I was like, Jenny, it's 2:40. Like, this is flying by. I absolutely positively love it. If you registered and weren't able to attend, we love you too. We know you're busy, and you get 7 days worth of access the day after the webinar airs if you register for one of our events with all of these amazing educators. If you are one of the, I guess, multiple million people who have access to the World Wide Web and who are watching this on the Lip Gloss and Aftershave website, on our on-demand webinars page, we thank you. We love you. Keep learning. Have a wonderful day, everyone. Bye-bye.
Thank you.